Earlier tonight, we saw Buffalo running back Damien Harris get taken off the field in an ambulance on a stretcher as a result of some concern for a neck injury sustained on this play towards the end of the first half. Welcome back, everybody. I'm Dr. Brian Sutterer. My goal in this channel is to help teach you about the medical side of the sports world. The mechanism initially does look a little bit unusual here, but I think what's actually happening is almost his helmet hitting number 64 on his own team. And as his helmet hits number 64, it causes it to kind of shoot upwards off 64's back, which is going to put a little bit of axial load directly into his neck, kind of right there, but then also some brief kind of quick sudden extension. And it's not a real significant amount of hyperextension, but I do think there's probably some axial load coming in from as he hits number 64, and then it just kind of gets exacerbated because his head has slipped up the shoulder pads, and then as 68 comes in, it kind of looks like his helmet is elevating upwards a little bit. I think we see it better here from the backside of this play. Again, as he comes in, there's not a huge amount of hyperextension or axial load, but enough that we can clearly see some jarring of Harris's neck and of his helmet. This quick, sudden, abrupt change in the position of his helmet is enough of an impact, enough of a load to be transmitted through that neck to raise concern for a cervical spine injury. And so it's not entirely impossible, even though it doesn't look as violent or aggressive as we see. I do think there is impact that's being transmitted through Harris's neck from likely some friendly fire running into number 64, and then as the Giants player kind of hits him from the other side. Now, as Harris goes down here, I want you to pay attention to what we see him do with his hands here at the bottom of the pile. We can see it almost looks like he kind of takes his left hand at least there and is trying to like open and close it like he feels something funny or something abnormal, and he does it with both of his hands. We can see it in the left hand and the right hand. If I rewind that a little bit, take another look, we can see how that left hand, the right hand, he's kind of gripping them a little bit abnormal, suggesting he's probably feeling some paresthesias or some tingling in his hands before he just completely puts them down at his side. And I don't know if this is because he recognized there might be a neck injury and he just needed to stop moving, or if he truly did have some temporary weakness in those muscles, evidenced by some of that flaccid tone with him just going limp. First medical responder that gets in here, we can see excellent job right at the neck, stabilizing the cervical spine, which is exactly what you want to do, and it's great that they promptly recognize that as soon as they got out there on the field. The next providers now that come out here, we can see they're starting to evaluate his gross motor exam, and so they're asking if he's able to grip the hand there. Don't really see much initially, and so that might have been some initial concern for true weakness in his neck to institute those cervical spine protocols. Everything looks like they did a great job following protocol. Of course, we all know Buffalo has a lot of experience and a really top-notch team doing this. We can see everybody is positioned here for the lift. I don't know if they rolled him or if they lifted him. You can either roll the athlete or you can directly lift the athlete just about 6 inches off the ground. We can see they have the spine board here ready to slide in underneath whenever this team has him lifted up. So again, excellent job by a team that we would expect nothing short of the right way to do this. And thankfully too, of course, we did see Harris give a thumbs up as he was being taken off the field. The big concern when you first get to the hospital is to evaluate for any fractures within the neck. A fracture could have a fragment that could injure the cervical spine. So step one is going to be looking for fractures. Assuming there's no big fractures, and yes, I realize this is a lumbar vertebral body, not a cervical, but assuming there's no fractures and the cervical spine looks grossly normal on imaging, one of the things that can happen, especially in football, is something called cervical neuropraxia. It's essentially like whenever you hit your funny bone, but do that to your spinal cord. And these symptoms will last usually less than 15 minutes, but typically no more than a couple of days before we really start worrying about more permanent or significant spinal cord injury. But think of it as if the spinal cord sitting in the vertebral column traveling down the neck has been stunned. Again, like I said, hitting your funny bone nerve. We'll sometimes describe it as burning hand syndrome because a common feature is paresthesias, or kind of that numb, tingly fire ant feeling, particularly in the hands, which we saw Harris on the field kind of shaking out his hands a little bit, very classic for this cervical neuropraxia. The big thing though, long-term to think about with these athletes, assuming that there's nothing acutely damaged in the spinal cord, is anybody who has spinal stenosis, which means there's narrowing of this canal where the cervical spinal cord typically runs, especially if it's congenital in nature, are more prone to having these episodes of cervical neuropraxia. And so whenever we evaluate an athlete who's had this sort of bilateral spinal cord contusion, so to speak, one of the things we're looking at is how much stenosis do they have in their cervical spine? Because if there's a lot of stenosis, it makes them higher risk for this happening again. And if it keeps happening each subsequent time, you have more chance of having a significant nerve injury. So short term, looking for fractures, looking for true bruising, damage to the spinal cord, but then long term, looking for any narrowing of the spinal canal, something called cervical stenosis, that would put the athlete at risk of further episodes of cervical spine injury. Most of the time, these evaluations turn out to be completely normal, so let's hope that's the case for Harris. Probably by the time he gets to the hospital, these symptoms will have resolved, assuming there was no gross motor deficit or true weakness in his arms. Even if he was just feeling the paresthesias, the numbness in both hands, that's enough for them to say, we have to do spine precautions, we got to get you in the backboard, get you to the hospital. But once again, great job, it appears, by the Buffalo medical team, and hopefully Harris has recovered by the time things get to the hospital and has no residual damage seen on the evaluation. Let me know, as always, any questions or comments down below, and until next time, we'll see you later.